started today, 20th of March 2023 in Chang at Fianga Polyclinic, and a multitude of internally displaced persons from across the country responded early this morning to benefit from these free medical services. Some beneficiaries recounted what brought them there.
We are here to consult free consultation from US, LECUD. Well, we got the register our names, got our numbers, and waiting.
Here today because I don't use a free consultation day, so my eye don't overworry me. I don't go sit arrange from Kongsamba, so I be here this hospital. So before I say no, let me to I try come and see them. I know say even now waiting they must help me. Then my eye must go. But if not be na this war, I don't forget this serious problem. If I forget for my house, I don't forget this problem.
They equally appreciated this initiative by LECUD-USA and partners.
This is not their first time. Okay. Last year or so, we were here. This year again, we are still here. And we do appreciate so much and pray that God who have brought them here will take them back to their residence.
There's that time them plenty. Because money we are all spending from Kongsamba for this my eye. And for year, they want work for me free. So I thank God for the free consultation where they get. And I beg God say may they continue for the railway where they do, and so God will put more effort for them. They will continue for the bless them.
For Gaza Media, I am Gillette Atem. The 3 days
Okay, good morning, dear viewers of Gaza Media. Good morning, and welcome to this short program here concerning LECUD-USA medical mission in Cameroon that started about 5 years ago. And the year in 2026, they are actually running the health campaign again at Mary Health Hospital, Fontaine. So we'll be bringing some live images momentarily, but before then, we'll have a panel of medical professional volunteers who have been, who started, some of them who actually started this program. We'll dive into that. We'll get a little bit of the history of how the program started, then and the future of this kind of program that is actually helping the less privileged back at home. So, without much ado, I would like to bring in Dr. Emon, for example, an oncologist, of course, whom you know him so well. And I'm also here with Dr. Fonkem Ekokobe, a neurosurgeon who run the Hidden Beyond the Horizon. So I want to welcome all of you, Dr. Nkita Richard, who is a psychiatric medical expert, will be joining on video. So I will not bring on the screen because it's on the audio. So, dear panelists, you are all welcome, Dr. Emma.
Thank you, Ernest. Thank you, panelists. And I'm glad to be here to share briefly with you guys and your audience.
Yes, Dr. Fonkem.
Yeah, I want to thank Gaza Media. I want to thank Dr. Ernest Kumba for giving Healing Beyond the Horizon the opportunity to be part of this panel discussion on the future of healthcare in the BLM division and also in Fontaine subdivision in particular.
Yes, Dr. Emon, let's just go back to it. I know when this program started, it was actually the humanitarian committee within LECUD-USA during the tenure of Tintino Charles Ntemtongo, where I think you headed that committee when the crisis broke out. People were suffering, people were displaced from Fontaine, the BLM to Chang in the western region. People were in Sancho, people were in Melon, people were in Bafoussam. I think the humanitarian assistance that you spearheaded started giving food. Then later on, a transfer. Can you just walk us a little bit how the committee was formed and the vision at that time?
Yeah, thank you, Ernest, for trying to take us down memory lane. So, like you said, when war broke out, and our villages began emptying out, and with it, the I think the real critical blow came when Mary Health of Africa, the experts there for Clary and Co. were forced to pull out, and that left us a very big void with no medical services, nothing. And so at the time I was heading the humanitarian committee, when we started out, we realized it was not only about food, but was also about healthcare. So one of the first things that we did within that humanitarian committee was to get, you know, a lump sum of money from LECUD-USA and pool all the health experts that were left from Mary Health of Africa, everything. People who used to work there who had not left, and some people had, some of our sons and daughters had come from Kumba and relocated to Fontaine when war started and other places. So we divided them into four groups, into four regions of Laban, since this was all about Laban at the time. And at Tonga, one group served at Tonga, another served Mbru and that area, and then the other one served the Sangwe and the that region, and then one group served Mindia. So we provided money, medications, and then we're supporting them remotely, you know. But ultimately, that program didn't last for long because of the security, deterioration, the deteriorating security crisis at home. And then, of course, as we were giving food to the people in all the places that you've called Melong, Chang, Bafusam, wherever. So one of the things that became apparent was the deteriorating health situation of our people. I mean, if somebody couldn't even have money to eat, how could they even have money to go to the hospital? And I remember there is an organization called the Pecha Foundation that we wanted to initially partner with because at that time they had just done a health campaign. But when they came to us, they came to me specifically. I think Terence Atem directed them to do. And when they came and I was talking to them, asking them basic questions about the confidentiality of our people's information, about partnering, how do we share the data that will be gathered from our people. And it became clear to me that they were not really serious about sharing the data. And so it was at that time that we kind of like had an epiphany and said, "But why can't we not actually even create something for ourselves?" And then, of course, that led us down to then go back to the Lukudu Health, subcommittee that we had established as an offshoot of the humanitarian crisis, of the humanitarian campaign, and then brought in the from chemists here. Then, of course, Dr. Rocky, I think Dr. Alamji, and Dr. I think quite a few others, Dr. Christella, and so on. I mean, I'm missing some names, Dr. Abila Primos and co. So we kind of sat down and then organized the first health campaign. That first one took place and limited to Chan. And then, of course, the subsequent one, as our people began going back home, we saw the need to then, take it down to Menchi. And then the following year, and join us. But then by the third year, we began expanding services. It was no longer just, yeah, Dr. Tubong is actually here, who was the first, one of the co-chairs of the humanitarian, the health committee, joining us. So we have, we now have had oncology, we now have cancer screening, we now have psychiatric, um, and then we have all sorts of different experts that we get, from Cameroon and supported by some people from the US. Yeah, so in a nutshell, that's how this has gone and has grown from strength to strength. And just, yeah, so that's what I have.
Yes, yeah. Thank you, Dr. Emo, for giving us that kind of brief history how the transfer. I think Dr. From that was here. Maybe he lost a signal, or I don't know. Yeah, before yeah, I wanted to bring him in, but it's good that Dr. Nchumbo is also here, who have also been to Cameroon, assisted in one of the health services, one of the volunteer. I think that was in Chang, right about a year or so ago. Dr. Kimo, you are good morning and you are welcome.
Thank you. Good morning.
Yes. So I just wanted to have you a little bit of experience on how, when you visited Chang at that time, how was the health campaign? How was the population? How do you feel? I know the crowd was there. The challenges.
Um, Challenges, of course, one of them was supplies. We still call on donors to give us as many supplies as possible. I attended the health campaign last year. Last year there were many people, that showed up in Chang. We were not able to go to the one in Fontem. We only took part in the one in Chang. We had a lot of people come from far and near, who came to Chang. And then the second thing was that, as much as we have medications, we always solicit for more medications because you
Mhm.
have like a limited amount or like a limited variety. We would like to see more medications, more variety, because a lot of people were just getting like 2 week supplies. We were not able to give more than the 2 week supplies. So that was one of the limitations that we we encountered when I attended. What else? What else? I think that was mostly it. You know, the logistics was, I mean, well organized. We had a good place to stay. Um, Sometimes network was a problem, but I mean, we fixed it. We fixed that early, and then the fact that we had a project coordinator who was just um, he was just we had a project coordinator who was specific to the campaign. I think that was very helpful because he took care of all the logistics problems that we got.
In terms of volunteering, like you volunteer for these services, if somebody who is also a medical personnel and want to just have an experience of, say, maybe joining the team next time, what would be your message or advice to that person?
So, I mean, as healthcare workers, the driving force behind a lot of us is that we are giving back. It's with all the knowledge you've learned, especially us here in the US, it's always, I mean, rewarding to give back to your population. It comes from the heart. It has to come from internal, and then not everyone is able to be there physically, due to different schedules, but there are people you can volunteer in different ways. You can volunteer for the planning, you can volunteer for the health campaign itself while in Cameroon. But I think we've had a lot of people, a lot of the people who went to Cameroon is just a really, really rewarding experience. Rewarding in that, you see, you're able, in a short span of time, you're able to help so many people. There are people with different diseases. I mean, they don't even know that they are sick. But the culture in Cameroon is, when you have this health campaign, I mean, everyone comes there, from things as simple as blood pressure management or diabetes management, to minor surgeries and to a follow up from like different healthcare personnel. So there are different ways that you can get involved. You can get involved in the planning. You can get involved in like giving supplies. You can get involved in being like hands on, during the campaign. So I think Dr. Christella and Dr. Avila have been, the brain behind this year's campaign. And of course, contacting Cameroon, Dr. Songani. There are very many ways that you could be involved if you wanted to. It
Mhm.
doesn't just end with going to the campaign. There are a lot of behind the scene work that is done, and we also need help with that.
Okay. Yeah, Dr. Chuma, just stay put. There are actually some live images that will be coming in. Dr. Elmo, before I come back to you, I think yes, Dr. Fonkem is back now. Let me bring him in here and ask him, Dr. Fonkem, you've been involved in this organization, this health campaign I will say from the beginning, we are organization hidden beyond the horizon, and I think yeah, we lost him again. We lost him again. Okay, we'll just wait until when he's able to connect back. But Dr. Emon, one of the things is when we talk about sustainability of this kind of program, because people have written to me privately that why is it that we're already organizing this program only once in the year, even though there have been a 30 days or rather a 90 days or a 3-month continual monitoring for those that have chronic diseases like hypertension, diabetes, etc. But is there a way that we could make it like kind of round year where people continue to have kind of checkup, regular care, all like waiting for one just will come in the month of March, then we wait until another year.
So, Ernest, thank you. Thanks for asking that question. And actually, that has been in the works. I think Dr. Tubong, as one of the co-chairs, will realize that just, I think, was that after the first, after the second or the third campaign, that was the direction we began already thinking. How do we make this like, when somebody asked, I think it was Jean-Michel Cancan, that somebody um, he went to see a doctor the and somebody and they said le docteur ne reçoit que sur rendez-vous, and he said que la maladie m'a donné rendez-vous avant de venir. For those who don't understand French, the poor guy was asking, somebody was telling him that the doctor only, receives people on appointment, and to which he retorted, asking the question, did illness give him a rendezvous or an appointment, to afflict him? Which is no. Yes, people in Cameroon, like all over, the healthcare is not something that is seasonal. It's not something that is intermittent. But we needed to start up something like a child needs to be delivered. They start sitting before the crawl, and then they start walking, and then they can run. For the past several years, we've been doing this, and the plan has always been to make this thing now to serve our people around the clock. What would that look like? The very next aspect of this health campaign, and I think this is going to begin next year, is going to be that we have experts. We look at Mary Health of Africa in Menji and ask the question, what are some of the services that they are lacking in? Of course, you have a doctor there who is a generalist. That means they don't have, competent surgeons. They don't have competent neurologists. They don't have competent cardiologists. They don't have endocrinologists. They don't have dermatologists. They don't have dentists, and all of this. So, but we have them in Cameroon. And so, one of the things for Lukudu to do, which is the health campaign is planning to now do, is to say, okay, how often, maybe every quarter, we kind of pay or spend money, get some of these people to go to to Mary Health of Africa and support Mary Health of Africa, the patients that are there, and not only that, have a plan where Mary Health of Africa, if the doctor has a problem that needs immediate attention, they can those people in Cameroon that are part of this Lukudu Health initiative, no longer just a campaign. With the LECUD-USA initiative, they will be available, to be displaced. So that is one thing. The second thing would be, if you noticed, the last 2-3 years, and even including this year, there were two health outreach, one in J and then one in Atonga. And so the plan is to make sure that within the year, we have this outreach in many, in all the locations within the area. And so we want to include, and then ultimately begin to train our own and deploy, maybe nurses, maybe like they call them extension health workers in Cameroon. Here we'll look at them like mid-level providers, NPs and or physician assistants. So you can train those people can then go to access the entire village and be there, and so that they can screen Do medical education. Screening would be, prevention, then early detection with screening, based on the things that we at the Central Committee can then begin to develop and put a plan in place. So those are the things that we hope are coming. And I think there's much more to come. I don't want to monopolize the
Yes.
microphone. Let me give
Yes,
it back.
yes, Dr. Emo, I think we'll come back to, especially we're already going to a point where sometime when you collect this data, I think I had an interview with Dr. Fonkem and Dr. Pamare in 2023 during the convention in Ohio. We were talking about collecting of data. Then now, if we were able to have access to internet, then we can actually begin to talk about telemedicine where you can actually sit here if you have this kind of trained paramedic personnel where they can collect this data, then you can actually analyze them and begin to make proper diagnosis and intervention. Yes, Dr. Fonkem is here. Let me ask him. I know Mary is already standing by. Mary, just stand by for a second. Let me ask Dr. Fonkem, your organization, your involvement in coming in with the partnership with Hidden Beyond the Horizon from the beginning to this. I guess my question to you would be how do you find yourself getting involved in this kind of endeavor that, looking at it when it started, I think that was 2022 or 2021, and we are now in 2026. Yeah, let me take,
Dr. Kumar, if you're talking to me,
yes, it's over to you.
can you hear me?
Yes, I think this will have a little
Yeah.
bit of
So
echo.
I want to thank you for the opportunity. It looks like we're having some technical issues this morning.
Yeah.
Uh, Healing Beyond the Horizon has been on the ground in the BLM division for the last 10 years. And before the war started, we had made some mission trips like Dr. Edmond started, but our focus was mainly on primary care. We quickly realized that uh, just taking care of patients without solving the problems of poverty and education was not going to be adequate. But when the war started and we now had a lot of internally displaced people now living in Chang and other parts of the western province, the southwest and the northwest province, who were all from the BLM, we quickly felt that one way to continue to do the work that had started with Healing Beyond the Horizon, going to Bangwa to treat people, wasn't going to be possible. So at that point, we quickly pivoted into partnership. And that is how our own partnership started with the LECUD-USA. And we are very happy for the opportunity to have done that because through that partnership, we had the opportunity to treat more, more of our own people in China and in the whole BLM division. We also had opportunities to not only focus on primary care, but also focus on all the other complex aspects of medicine, such as surgery, ophthalmology, or obstetrics and gynecology. And right now, as Dr. Emon Flefek and other people who have had opportunity to speak with this audience have said, now the goalpost has shifted. Right now, we're also now not just focusing on creating regional access to care, where we're not taking screening and healthcare to a lot of regional areas in the BLM or in Lebanon, but we're also focusing on defining what the future of healthcare in Lebanon will look like, especially when we look at all the complexities and we look at bringing in highly needed specialties such as surgical, cardiology, neurology, endocrinology. So this is something, and this is a discussion that we're going to have as an organization, and also with all our partners on the ground as we try to streamline this care and to make it much available to our own people.
from Mary. She's now ready. Let's hear from her and what is actually going on. Mary, can you hear me? Can you give us a brief introduction of what happened this morning?
May I proceed?
Yes, go ahead.
Okay. Yes, like I was saying earlier, today, which is the third day and last day of this health campaign, the turnout is still the same. The people have still come in their numbers to get themselves tested and treated. And as of yesterday, which was the second day, they succeeded in registering and treating a total number of more than 1,000 persons. And today, with the number of persons that have turned out today, I believe is going to be more than. So I can say that LECUDO USA and their partners would definitely meet their target for this year's campaign. And it goes same for the different units because the surgical unit compared to last year, this year they have been able to perform quite a number of surgeries if you are comparing last year.
Yes, Mary, I think I saw one of the production that you sent out last night. One of the patient was very emotional, an elderly patient of probably about 60 years or more. Uh, he felt so much pain. It was like he was
Yes,
having joy. It was mixed feeling. So what was actually going on?
that particular man came to get himself treated. And after the treatment, or maybe in the process of the treatment, I asked him what he wanted to say to those who organized the campaign. And he was moved to tears. He wanted to thank the doctor, but his emotions failed him. And I was there throughout the process, consoling him and telling him that he should not worry, he will definitely get better.
Panelists here and we'll continue this conversation. Okay, Dr. Richard Inqueta too has just come in here. Dr. Richard, we've been discussing the issue of collecting data, getting different expertise involved. I know you are of the psychiatric area where it's becoming something prominent in our area, especially the trauma post this crisis where family has been distorted, children growing up in separated home, not because of family dispute, but because of the war where people have to live elsewhere. People are running, they are gunshot, they were gunshot at that time. So in this area, do you have like kind of maybe a long-term plan? That's something that you can propose to the Kudu USA or to the Hair Committee in going forward.
Okay. Good morning, everybody. Good morning, Dr. Ernest, Dr. Edmund Falifak, Dr. Tumbong, Dr. Ikokobe, and Mary, who is on ground zero. So I just, I really want to appreciate this opportunity for us coming together to discuss healthcare in Lebang and in Lebialem. So as far as mental health, the and with the crisis on the ground, you will agree with me that the effects are really a lot, in terms of people's mental health combined with what is happening in the medical field. So as far as looking at long-term plans, like we had a discussion the other day, and I told you, like when I did my DNP, my project was on telehealth. And I've had some discussions with Dr. Edmond on how, just kind of looking at how we can use telehealth to improve access, not just in mental health, but also in the medical field in general. And so there are really some promising, projects that can be put in place, and but that will require, collaboration and discussion among the healthcare professionals that we have both in the diaspora and back home, so that we can come up with something really comprehensive that will benefit our people. And like I told you again yesterday, it is unfortunate that I was not able to be part of this medical campaign this year because of the family crisis that I had. So I just had to, stay back and just go through my grieving process, um, and not be too involved. But as far as long-term plans, we do have long-term plans, and we're going to be discussing that with the various stakeholders to see what we can do.
Thank you, Mr. Moderator. First of all, those numbers are impressive, especially given that they're happening in many areas of Africa. All of us who are part of this panel should be very proud that through this initiative and through other initiatives, most of our people are returning back home to the BLM division, to Fontaine subdivision, and are able to utilize the services that Mary Heart of Africa or some college in Fontaine has to offer. Right now, the discussion should be how do we make sure that this return home is sustainable? I know most of these people were internally displaced during the war or the political unrest that took place years ago. Of course, the situation is not fully resolved, but the political situations and the stability is improving. Point where people can be confident going back home. So the question becomes for most of us who are living in the diaspora and who are possibly very fortunate to say, hey, how do we make sure that the doors of mental health of Africa remain open? How do we make sure that supervisory college and other educational institutions in the BLM
Mhm.
remain open so that these institutions can continue to attract these people back home? Because we know that if somebody has a way to educate himself, they have a hospital to go when they get sick. They also have a means to support their families. Then returning home is not going to be a problem. I believe that these are the kind of discussions that we as Leban people, we as the BLM people, in conjunction with most of our partners at home and abroad, we need to have, and we need to have this in a very serious manner if we want to be able to take some of the lessons from the political crisis and to turn them into something much, much better. And healing beyond the horizon through our own partnerships with a lot of other, um, what I call gratitude or grateful givers,
Mhm.
are ready to have a conversation with the rest of our communities.
Right. Thank you, Alice. Thank you so much for that kind of holistic presentation. Drawing like, because first of all, if you don't have the finances, it's quite true. Even the health services are there. You may not even have a very little amount to pay for, and of course, if people are returning home, you also have to provide them means for their daily sustainable living, because good health, as Dr. Emo said earlier, it starts from eating healthy, having a better life, having a hygienic or water system at home. All that contribute to your healthy lifestyle. I thank you so much. Uh, Dr. Chumo, let me ask you this question as a pharmacist. One of the issue that they met, because I remember last time when I'm trying to unmute you, when Dr. Etienne Asongu is the main coordinator on the ground came here. Can you unmute yourself? Okay, yes. When you came here, the problem was that of the medication. He stressed so much on the issue of medication, because it's like one of the things that, especially in primary care, people come in with little illnesses, and this the one after intervention you have to give them something to maybe begin to clear it, take away the symptom gradually, and it's very challenging and it's very expensive in the pharmaceutical industry. What do you think? Any suggestion that you can give maybe to the committee, uh, how to maybe raise money or maybe meet us some kind of like big pharmaceutical to maybe actually donate?
I'll actually defer that to Dr. Ekokobe because he's done a good job procuring medications for us.
Mhm.
So, we have so many medications, but I think a good strategy will be, instead of having every medication that you can find on the planet, at least have a medication in high enough quantities in each class. Right? If
Mhm.
you're going to treat, let's say, if you want, for instance, if you want ACE inhibitors, instead of having every ACE inhibitor that you can find, you get one like lisinopril, and you have that in large enough quantities that you are able to disseminate that to the thousands of people that you're seeing. Right. So the target would, in this instance, will not be to get every medication on the market, but having at least a representative from each class and maybe an alternative, so that if, let's say, someone doesn't meet the criteria to use one medication, at least we have another option. Right? There are medications that work best in like African American population, making sure that we are optimizing those medications. Using our partners like Healing Behind the Horizon, I think Dr. Kokobe has been very instrumental in getting the medications that are needed. It will be nice if we can have those in like more quantities, right? So that we are able to sustain the number of people that we are seeing. They are talking about 1,000 people in a day. Just imagine if we're going to give everyone like a 30 or a 90-day supply of medications, making sure that we have enough. Because it is not only about the campaign, what happens after the campaign, right? If they're coming in, you're seeing them today, you want them to be able to get medications for the next 30, for the next 90 days, um, and beyond. So it's not just about procuring the medications, but making sure that we have it in enough quantities to give the people that are showing up. So at this juncture, we implore anyone, there are people who run these campaigns in different capacities in Africa in general and Cameroon in particular. If you have any ideas on how we can get procure medications, I mean the health campaign or the executive or the committee is willing to hear your ideas, and they are willing. I mean, we are open. Would like more ideas on how to um, get these medications.
Dear viewer, I think the LECUD-USA Health campaign is really made up of experts of different walk of life. I don't have the time to study, to sit here and give each and every person biography or each and every portfolio on what their expertise is, but I think it's a blended across the board of medical experts that we can think of. Dr. Emon, we were talking about, let me unmute you here. We are talking about sustainability uh, of this program. I think you are muted for some reason. Yeah, we were talking about the sustainability of this program, and we're diving into an area where we're able to connect this data to reduce costs, then do it more efficiently so that people can benefit more from it. I think Richard. has talked about telemedicine. Yeah, Dr. Fonkem has also mentioned about uh, livelihood. That's something you want the kudu about people to have in the convention or to try to sit down, discuss way. I know me and you have talked some of these things behind. I'm glad that each and every person is getting through the same direction on what can we do to, number one, sustain this kind of program. Number two, make it more efficiently and less costly by by this new technology where you deploy, you train people basically that are local, that they can collect data you see here. uh, you can actually go through. For example, I think Dr. Ntumo, you bear with me that if somebody collect somebody medication history and give you all the medication that you can sit here and actually go through them through medical or through utilization review or MTN and actually say, okay, you don't need to be on this medication. This is double therapy. You need to be on this one. You need to do this. We need to add it. We need to take this out. And without necessarily having to go to Cameroon. So that is something that we should be looking, or where I think Dr. Emo was trying to. Dr. Emo, can you talk a little bit on that?
Yeah, so the pillar of any good healthcare program, rests on, I mean, three pillars. It rests on three pillars, right? You have to have access, you have to have affordability, and then, of course, you have to have quality. In today's world, all of these things, you can decrease the cost exceedingly in terms of how you, and that is, increase access and elevate the quality through through the digital platforms. One of the things that we've not been able to apply consistently has been the electronic medical record system. And that is something that I work with a group of my team in California, and who builds electronic medical records. And we applied it. I think we did it once or twice, but then the problem was really just being able to have enough sufficient data, I mean, internet, and then enough number of laptops. So that should not be a difficult thing at all, because this friends of mine, or maybe partners of mine, that's going to be something that it's offered to us at a very, very minimal cost, where it is just going to be maintenance, buying space in the cloud, for us to be able to use that. So that way, as I think I spoke with Richard about that as well. That way, there would be, and today actually you can have AI enhanced systems. I mean, they are AI enhanced system. That is the future of medicine. That's where medicine is going, where you collect this data, and that data is in that platform. You lock up anywhere, you can do consultations, you can do medication review, you can do all sorts of different things. You can actually consult, you can actually provide second opinion to your colleagues elsewhere. I do that on a very regular basis. Currently, I just hope that the project that we're currently trying to carry out in Bangladesh now. There is a new app that has just been developed as well with that team, and that would actually help us monitor vital signs. It would help us monitor everything from diet, vital signs, everything, medications and stuff, so that when that gets lumped in there, you have this information at your own time. You just get up, get this information, review it, and then put that information back there for whoever needs to be consulted. And the people would have this app on their phone, or on their phone, so they don't need an extra device. So that is coming, and I think that within the next year or two, LECUD USA and hopefully the entire LBLM will be in a very, very good place, because we would leverage these facilities to be able to deliver quality care to our people. The other thing I have to talk about, we've been talking about affordability and sustainability. A couple of years ago, we were also trying to work with the Catholic Church. They had an insurance policy that was established by a certain German group. Unfortunately, that insurance policy, really, we were working with the Catholic Church in Manfei, working to see whether we can actually um, enroll all our people in that program. But that program, I don't know whether it was because of the crisis, there were some issues with it. We need to revisit that issue of health insurance for our people. And of course, we had talked about the training, things like school health, nursing. Can you just imagine how many kids stay away from school, miss school just because of what? You know, uh,
Fever.
Either
Yeah.
malaria, or maybe there are some skin diseases, and some children will need to be shy. I mean, they will be so shy they can't actually even go to school. Just sometimes it's just trimming and keeping. So getting a school nurse to be there, beating these kids, and doing it not like the teachers, but like a healthcare provider, not punitive, but corrective. That would be transformational. So there are a lot of things that we as Lukudu, and I hope we would extend this to the BLM as a whole, can do and will do. And I think that we are a very, very blessed village. If you look at the amount of human resources that we have, and look at the amount of possible, even the money that we can generate, I have no doubt, in my view, in the next 2, 3, 4, 5 years, 10 years from now, a lot of some of our own kids will be cutting us $1 million check. Okay, for yes, just mark these words. Some of our kids will be in places that the things that we are doing now, cutting $1,000 check from our meager resources, we're going to have people within our group that would cut us $1 million check. I just don't have the doubt about that. It's a matter of time. But until that comes, I think that as what we can see where people are doing, and let's give credit to certain individuals for what they have done. For 2 years, a couple was paying the doctor $1,000 a month in Medi Health of Africa. For us, a couple was paying that. And if you look at that and just ask yourself, if rather than us as the bank people asking, what has Labank done for me? We've asked the question as Kennedy, to borrow from Kennedy, what have we done for Labank? What have we done for the BLM? What have we done for the people there? It would be something that all this money that we're talking about, we can raise this funds to be able to start doing what needs to be done and holding it and planning. But we need also to keep that data. And hopefully, with this platform, by next year, we should actually be able to start doing that on a more permanent basis. One last thing before I give it back. Um, I think two actually. One, when we talk about health campaign, if you notice, Lukudu USA, for instance, that has been the engine behind this. If you come and think about our members, most of our members, there are quite a number of members, Lukudu USA, who don't know, who didn't grow up in Fontem, who didn't grow up in Laban. But there are people who live in Monyenge, in Kata, in all of these places. What are we doing for them? The other places that we need to be able to figure out ways how to meet them, whether it is health education, whether it is empowerment and things like that. We need to be able to figure this out. And luckily, we are going to get, so by the time we will put all this comprehensive together, and we should not forget ourselves here in the USA. As somebody who actually constantly sit and guide people, or maybe help people out for stuff, we should be able to also set up a program for our own people here in the USA to benefit from this embarrassment of riches, as we would say, because that we have in the field of healthcare. Frankly, if you look at the number of healthcare professionals, how endowed we are, our people should not really be going without
Yeah.
healthcare here. Or if you go and see the doctor, half of the time our people go and see the doctor and they don't know what the doctor said. When you talk to them, so just having a program that can be able to reach out to them and be able to, like, say, deconstruct some of the doctor speak and stuff like that, especially when the doctor is not somebody that speak in
Yeah.
tone,
Yeah, ethnicity.
so on and so forth. So those are some of the things that one has to highlight, and things like, and just say we are on a good footing. We just need to take it up to the next level so that we don't remain like that kid who has been crawling for 3 years or 5 years and congratulating itself. I want to see us now walk and run. Thanks.
Yeah. Yes, Dr. Emo, thank you for that elaborate explanation, especially when we have about 4 months or 3 months to the convention, where most of these things have been stopped and budget voted. I hope to see all the panelists, especially, I know, Dr. Fonkem, you have a very tight kind of schedule, but I would really like to see you in Virginia, shake hand with you again, and to really talk more on this and maybe the way forward. We'll begin to talk about the sustainability of the healthcare and people returning home. The only hospital that is reviving people in the very entire region like that is Ordinary Health of Africa. I will not even dive into public health services that are still at a very infantry level after post-crisis and what have you. So I thank everybody for coming. Let me just give the opportunity for everyone to say maybe 1 minute last word, uh, maybe your impression or motivation for other to join. I mean, there are tons of healthcare workers, nurses. I mean, you name them out here in the US, the bank people, the BLM people, that sometimes they just like, who cares? I don't want to say that they think that who care or that they don't know or they feel like it belongs to somebody else. Dr. Chumo, let me start with you.
Can you hear me?
Yes.
Well, we want to thank LECUD-USA. It is, an applaud. It's applaudable. It's a commendable effort that they do every year. We want to thank our healthcare professionals, those that have worked behind the scenes and those that are on the ground. It takes a lot of work and a lot of planning to put this together. We want to thank our Lebanc partners. We want to thank the people who volunteer and the people who put resources into this every year. It is not an easy task. It's not an easy feat, but they keep doing it. um, we will definitely get better. We implore all healthcare workers. We know we have Lebanc healthcare workers in their numbers, NPs, PAs, medical doctors, dentists. We need everyone in all these varying fields to come together and make this better. you know, um, and we thank those on the ground, Dr. Songani and his team, Dr. Michel, who have worked tirelessly to make sure that these campaigns go on successfully. I mean, the numbers in Fontem should encourage everyone, and encourage everyone to get involved for the coming years. And thank you for having me today.
Yes, thank you so much, and wish to see you again soon when we'll have another opportunity. And thank you for your voluntary services. It's been a long time since we've met, so hopefully we'll meet in Virginia. Yes, Dr. Richard, I know you've been on the ground not this year, but I just want to get the last word from you with regard to what is going on, or any motivation, anything, as we wrap up this program.
Thank you, Dr. Ernest, and thank you to every panelist on this discussion. So I just want to say that when I look at the images in Mary Health of Africa Hospital for the medical campaign, the health campaign, I am really impressed. But unfortunately, like I said, I could not be a part of it this year. Not being a part of it doesn't mean that I am walking out of the project. I am still very much involved in the project, and next year, God willing, I will be fully involved. I plan to be on ground zero right there at that hospital. Volunteering and doing something for the community, because what the volunteers are doing, what Lukudo USA and every partner has done and is continue to do, is really something that is very impactful, and it doesn't go unnoticed. Even in the heavens look at it, and they will always respond. All the finances that people put into to make this campaign a reality will always be replenished. And so I just also want to take this opportunity to, call on every son and daughter of Leban, of Lebialem, to say, we are really blessed that God has given us that opportunity. God has given us those resources. First, the opportunity to be in the diaspora in America, where we can hustle and make money and then turn around and try to give it back to the community, because I don't think there's anything as satisfying, as fulfilling, like giving back to your community. Seeing those people there who don't have anything, but when you go to give it to them, it is really, really impactful. And also, I want to call on every one of us, every Lebialem, every Lebang son, to have that mindset of lifting one another up. That we should all strive to lift one another up, to partnership with one another, because you can't do it alone. But when you come together as a people, and people with the same mindset, with the same mentality, you can do a lot of stuff that if you're just struggling to do on your own, you're not going to be able to go as far as doing a partnership. And then, talking about medication, I think I spoke to the CEO of Bernard, who is on Ground Zero, and we really appreciate them, about, because we have this organization, MAP International, and I think their medications are really cheap, but you have to give enough time for the turnaround. So I think that's something that we can look at for the next campaign, and provide enough time, because they send you the list and you can go through the list and pick up every medication that you want, and then send it to them and they'll ship it to you. That's an avenue where we can explore to see how to get cheap medication. And so I just want to say again, thank you, everybody. Thank the partners. We thank Lukudo USA and all the partners. We thank the volunteers who are currently on Ground Zero, who have sacrificed, left their families here, and they are there on for community service. So I think that's it for me. Mm.
You so much. I think let me ask Dr. Fontaine, the CEO of Hidden Beyond the Horizon, about uh, about his. What do you make of all this? I mean, this is something that you have been very passionate with. You even took a team of people from your organization and went home with, looking at what is actually uh, going on now. I mean, in the word, I know we will meet with a promise. You must promise that we'll meet in Virginia. Uh, Dr. Fontaine?
Thank you so much, Dr. Ernest Kumba. There's a saying that said, to whom much is given, much is expected. So, Healing Beyond the Horizon and the entire Healing Beyond the Horizon organization is very thankful to have given the opportunity to work with partners like Lightbridge International, LECUD-USA, and other partners on the ground in order to deliver meaningful healthcare to our communities in Cameroon. I know this would not have been possible without the support of all our donors and all our friends who in their lifetime might not have an opportunity to ever travel to Cameroon to see what their resources have done to this organization. We, we hope and pray that God will continue to replenish all those people who gave to support all these missions all over the years. In addition, there's also an African proverb that says, if you want to go fast, go alone. If you want to go far, go as a group. So we're very grateful in our partnership, especially with Gaza Media, to have been able to amplify all the work that all of the organizations, including us, have done in Cameroon, especially in Chang, and now in the BLM division, with a focus on healthcare, education, and community development. So thank you for your partnership and thank you for using your media capabilities to showcase the good work that all of us are doing. I hope that this will also inspire other people to wake up and to put their own resources together, either financially or time, to continue to serve the community. Thank you.
Dr. Fontaine, for that wonderful presentation and for your time and for all the services. Uh, Dr. Emon, now I think one thing that we did not touch was the oncology partnership that has kind of joined this team that you kind of that is an organization that you have brought in to also help. Maybe we didn't have time to talk on that uh, unless you want to touch on it. But I think the takeaway message that we're moving forward is that in terms of sustainability, moving on to the convention, I think the consensus is that we should be able to come out and adopt a strategy plan. And I hope the committee will go back and work on something that they will be able to present the way the hair care or the hair campaign should not just be a 3 day something, but taking it to the next level based on what we have talked of collecting data, able to make that data accessible to the hair experts around the globe where they can actually make informed decision. Different ideas, how to do procurement that Dr. Richard was saying. Dr. Funkem has been very good in helping with procurement of medication. At least we have all the experts. We have Dr. Nchumo, a pharmacy. We have all kind of people that they can come in and say, okay, this is what we do. These are the best idea and things like that. I think that is something that we should be looking at. Dr. Emma, over to you.
Yeah, I know. Yes, we haven't had time to talk about the cancer program, which we forwarded into this. I think this is the third year that we'll be doing cancer screening. And I think that the Cameroon Oncology, just the Minister of Health was asking for data. And I think that data also was also submitted, including data from Laban. And so this is actually an law and Chan, the ones that we did, so that people can begin to see that some of these things may also, in addition to helping individually, hopefully they can help the government shape policies, as in the future. Um, and I would say to people, there is the Cameroon Oncology Center in Douala. You just go there, just call my name, let them know. I and that comes with its own lot of advantages. And if you have any issues to dealing with cancers and you want to reach out to us, I'm here. Everybody, if you text, we will be able to get back to you and help until we are able to get to the point where not only are we able to prevent, but to do early detection, because with early detection, most cancers can be cured. Actually, I use the word cured very intentionally. But late on in the game, it is not only a lot more expensive, but in many cases, we're no longer able to cure. We can just treat to prolong life. So it's really, really important that people begin to start thinking about, take these opportunities to screen themselves. Um, and so as we come to from them every day, once a year, hopefully we'll put processes in place where we can screen more and make it a lot more, accessible to the general population. Um, Overall, I would say for everybody, somebody dug the road that you and me walk on. Somebody have built the schools that we attended. Somebody built the hospitals where we sought care. And the list can go on and on and on and on. And just actually for really, and I don't think that there is any accident, for people coming from wherever they came through to get to this blue dot planet that we call Earth. And I have always contended, I'm no theologian, but I think if you're asking yourself, when you get to Piligate, questions are not going to be about how many times you went to church. No. The question I think was going to be, Or how many times did you pray? I think the question is going to be, when those people were suffering, what did you do for them? What did you do for the list of the brothers or the sisters? And so if you are here and you've had the chance, and many of us are not here because we are smarter than the other people or we are more hardworking. The way more people that are more smarter, that are smarter and more hardworking. But for some reason, we are here. Let us use that opportunity. Let's get what we get and share with our people. There is a reason why we share those genes with them. And so that's what I would appeal to the people to do. If you drink coffee, the calculations are that if you do coffee, 1 cup of coffee, I'm not sure where you live, but it will be around $3. If you make it home, you'll save $2. And if you drink 1 cup, what? How much? Poor people like me don't go to Starbucks.
Well,
All right, but let's say $6. Yeah, thank you,
yes,
thank you, bro, for letting me know. But let's say $6. But let's see that the calculation is, if you buy that coffee and you are doing it yourself, you'll probably be saving four
$3.
bucks a
Yeah.
day.
Hmm.
Times 1 month is what? $120. I'm asking you to just set aside, keep 50% of it and just give us 50%. Yeah, so that those people, the person who was overcome by emotions, that there can be more of them. The kids who don't have milk, the no food and things like that. Our people who are sick at home, we can be able to help them. I mean, that's all I wanted to say. So now that I think that, and for the people who have donated, who have contributed, many of whose names we cannot even call that exhaustive list, I think we continue to say thank you enormously for everything you do, and may you continue to feel it, within you, to deeper into your pocket. And when you see me coming to raise money for other things, please don't run. I'm not using it for myself. It is actually for the greater good. Thank you.
Yes, yes. Thank you, Dr. Emo. Thank you, panelists. Before we'll wrap up this announcement, tomorrow at I think will be 10. Tomorrow will be 10 a.m. Cameroon time. Will be around 5 or 4 a.m. Eastern Standard Time. The triple anniversary of the folklore movement, the 60th anniversary of the State of Wisdom College. There's an event that will be taking place on the school campus of State of Wisdom College, the pioneer, yeah, when State of Wisdom was created. So this year was dedicated to the celebration of the 60 years of the folklore movement. Part of this hospital being part of that activities. So they have an event on campus, and Gaza Media will be doing a broadcast on that event. So I urge the audience to stay tuned when we bring those footages, live coverages, and discussion of how this movement that we are here, out this hair campaign in this hospital, which is part of uh, their institution, other kind of history. The Slotum student, some of them are here with us. We don't want to talk about that for now, but that is reserved for tomorrow. So it will be, yeah, those are students of Slotum, even that have actually come to receive their own health care or health screening here at this hospital. But tomorrow is a day that is dedicated for the Swezan on that campus, where there will be a tour, there will be a presentation, there will be a whole bunch of different activities, starting with math service in the morning. Then we'll go back to campus so people can tune in and watch that program live from the footage that will begin to you. Until then, Mary, can you hear me? If Mary, it appears you are busy, we'll let the audience go for now, and we want to thank all our panelists, Dr. Emon Forefe, Dr. Chumbanga, Dr. Fonke Mekobe, Dr. Richard Nkita. Yes, yeah, for your
Okay, then.
time that you have been here. Yes, Mary, is there anything you want to give the last closing remark then before we leave?
I just want to use Dr. Elizabeth Nkem's word with regard to mental health. She said mental health is not a luxury, so people should not be afraid to talk about their issues with a doctor so that they can feel relief and get themselves treated. And I will be concluding by saying that from my experience, because this is my second time covering this health campaign, this free health campaign, I am really impressed, and I have equally benefited from this campaign because I got my eyes checked. And I would like to appreciate the organizers and the sponsors.
To go spend the time in Maryhead of Africa in Menji to provide us this reporting. We thank you, and we hope you stay safe, and our regard to everyone down there, and bye bye for now.
Okay.